Hello, my name is Barbara Levin. I'm the Executive Director of NF Mid-Atlantic. We're a 35-year-old nonprofit agency devoted to neurofibromatosis support, awareness, and education. Neurofibromatosis is a variable and potentially devastating genetic disorder that causes tumors to grow anywhere on the body. It's often misdiagnosed, and its ramifications are best known by those who have NF, care for someone with NF, or a physician who specializes in NF. Neurofibromatosis has hundreds of manifestations, ranging from the relatively minor appearance of cafe au lait spots to extreme pain and death. Anyone who lives with neurofibromatosis, either as a patient or caregiver, knows its unpredictability and the essential codependence they have with the medical system. Hence, we've asked Stacey Platte, I hope I pronounced her name correctly, to help us negotiate the intricacies of the Affordable Care Act. It's our wish that everyone with NF get covered. Before we begin, and I introduce and turn this over to Stacey, I want to take care of some housekeeping items. There's a question pane on the right side of your screen. If you have questions during the presentation, simply type in your question and click Send. At the end of the presentation, we'll do a question and answer session and take as many questions as time permits. I will be muting everyone while Ms. Platte speaks, but feel free to write your questions. This broadcast is being recorded and will be available on our YouTube channel in the next couple of days. Feel free to share it. I now want to welcome Stacey Platte. Stacey is a health insurance specialist at the Centers for Medicare and Medicaid Services, also known as CMS. Stacey works for the CMS National Training Program, where she conducts in-person and web-based trainings to teach beneficiaries and partners about the programs that CMS administers, including Medicare, Medicaid, the Children's Health Insurance Program, CHIP, and the health insurance marketplace. She obviously has a deep understanding of this topic, and we're so honored and grateful that she's joining us today. And I turn it over to you, Stacey. Thank you.
All right. Thanks so much, Barbara, for that introduction, and good morning, everyone. I'm happy to be here with you today to talk a little bit about the health insurance marketplace and all of the details and what you might need to know to get covered. So as you've all heard, the health insurance marketplace is open, and it's a new way for people to buy and shop for health insurance all in one place through one application, and that's really exciting. So we're going to start out by looking at the Affordable Care Act generally, see some of the other benefits that the Affordable Care Act has had in addition to the health insurance marketplace, and then we'll move on and talk a little bit more about the details of the marketplace and what you need to know. The Affordable Care Act was signed into law in March of 2010. It's also known as the Health Care Law, and that's how we'll refer to it in this presentation. But it had a lot of other benefits in it that affected health insurance and the way health insurance operates in this country, in addition to the health insurance marketplace that we've all heard so much about. Some of the benefits of the health care law are listed on this slide. Young adults up to age 26 are now allowed to stay on their parents' health insurance plans, which is an enhancement, if you will, because previously young adults may have been kicked off their parents' health insurance plan when they were no longer dependents, when they went off to college, and earlier than age 26. So there are many young adults now who have benefited in being able to stay on their parents' health insurance plan. In addition, there have been some improvements already for people with Medicare. The drug coverage that is offered for Medicare beneficiaries through Medicare Part D, it has been enhanced. The coverage gap or the donut hole that previously existed where people with Medicare had to pay 100% of the cost of their drugs for a certain time, that is being reduced through discounts to people with Medicare. There are also more free preventive services, that are available to people with Medicare and also people with private insurance, so that they can have access to free preventive services before they even meet their deductible in some cases, and without any cost through co-payment or co-insurance. Lifetime limits on the amount of health insurance benefits you can receive have also been removed from health insurance coverage, so insurance companies can no longer limit the amount of benefits you can receive from their company over your lifetime, which is a really great benefit for people who had high utilization of health insurance services. So those have already taken effect in previous years, those benefits. There are also some benefits that just started on January 1st last month, and we'll take a look at those now as well. One of the biggest changes to insurance that has taken effect as a result of the new health care law is the fact that discrimination due to pre-existing conditions or gender is now prohibited. So women can no longer be charged more than men for their health insurance coverage, and also people who have had pre-existing health conditions can no longer be charged more because they have those health conditions, and they also can't be denied insurance coverage because of their pre-existing conditions. So this is something that's also really exciting for people who have been uninsured previously, maybe because they couldn't get insurance or it was too costly. Both of those items have both been prohibited and will no longer be a factor for folks who are looking for health insurance coverage. Annual limits on insurance coverage have also been eliminated. So previously an insurance company could have limited the amount of benefits you could receive not only through your whole lifetime, but in the course of a year as well. And those limits are now eliminated, so you don't need to worry about those. There are also advanced payments of the premium tax credit that are available now, starting in 2014. We'll talk about that more, but basically what that means is it's a way that you may be able to get lower costs on your health insurance through the health insurance marketplace. There's also a tax credit for small businesses that has been in effect for a couple of years to help small businesses afford to offer health insurance to their employees, and that tax credit is increasing this year as well. More people are eligible for Medicaid now in some states, as you may have heard, in the states that have chosen to expand their Medicaid program and offer Medicaid to an additional group of adults that previously may not have been eligible for Medicaid health coverage. And then lastly, of course, the health insurance marketplace began last month. Coverage is now effective for consumers who enrolled last year. And we're still in that first open enrollment period. So if you're still interested in getting coverage, you can still compare plans and enroll up through March 31st of this year. So we'll go on now and talk about the health insurance marketplace, what it is, how it works, who can enroll, and all of that good stuff. So the marketplace was part of the health care law, of course, that I just mentioned, the Affordable Care Act, and it is a new way for people to compare their private health insurance options, apply through one place and see what they're eligible for, and be able to enroll as well if they're interested in purchasing coverage. The health insurance plans that are offered through the marketplace are known as qualified health plans. And all of those qualified health plans, or QHPs, have to meet a certain set of standards and offer a certain set of benefits so that you can know that whatever health plan you're looking at in the marketplace, it does meet a certain set of minimum standards, and you are able to compare the plans directly to one another because you do know that they offer the same basic benefits. So you'll be able to compare the plans directly, looking at price or benefits or quality or For instance, their provider networks or other things that may be important to you in a health insurance plan, and you'll be able to do that all in one place through the marketplace. You may have also heard the marketplace referred to as the exchange or Obamacare. All of those terms are referring to the same thing, to the health insurance marketplace. There's also a marketplace for small businesses. So the first marketplace I've been talking about is for individuals or families who are looking for health insurance coverage. The second portion of the marketplace is for small businesses. It's called the Small Business Health Options Program, or SHOP. And this is a way, it's a new option for small businesses to use to be able to offer health insurance coverage to their employees. We'll talk about that just a little bit later on, but mostly this presentation will focus on the details of the individual marketplace for individual consumers or families. So the marketplace, of course, is a new way for you to shop for health insurance coverage. You can go to one place and check out all of the options that are available to you in your area. You'll fill out one application, and you'll be able to find out if you're eligible for a qualified health plan, if you're eligible to get lower costs through that qualified health plan, and also if you might be eligible for the Medicaid program or the Children's Health Insurance Program in your state. It's been estimated that about 90% of people who were previously uninsured and didn't have insurance will be able to qualify for savings through the marketplace, either through the tax credits, for instance, or through the Medicaid or the CHIP program. All of the information in the marketplace as well is presented in plain language to help you understand upfront what the costs and the benefits and all of the details of the qualified health plans are in plain language that you can understand without having to dig through a bunch of fine print. So as you may have heard, there are different ways that the marketplace can be run. Each state had an option to choose how they wanted to run and to function in the marketplace in their particular state. There are three options specifically. A state can choose to create and run its own marketplace. We're calling those state-based marketplaces, where the state is running its own operation. The second option is for a state to partner with the federal government to run some marketplace functions, but not all of them. And this is called a state partnership marketplace, where the state is partnering with the federal government. And then the last option is the state could choose to have a marketplace established and operated by the federal government, and that is called a federally facilitated marketplace, where the Department of Health and Human Services is running the marketplace on behalf of a given state. So states have this option to choose what they wanted to do, and there may be changes in the future. States have the option. They can change at any time and decide that they would like to have their own state-based marketplace in future years, for instance. They do have the ability to do that once they give proper notice to the federal government and put plans in place to implement that change if they'd like to do so. So as I mentioned, all of the qualified health plans cover the same set of basic benefits, and these benefits are called essential health benefits. There are 10 categories of these benefits that all plans in the marketplace must cover, so that if you're looking at any plan in the marketplace, it will offer at least this basic level of benefits. So the first benefit that's required is ambulatory patient services. Basically, this is outpatient services. So, if you needed care to go to a doctor or a specialist, that would be covered under this benefit. There's also emergency services that are covered, of course, for urgent or emergency situations if you need care. Inpatient hospitalization, if you do need to go into the hospital for a procedure or anything else, that will be covered. Maternity and newborn care for you and your baby. Mental health and substance use disorder services are covered as well, and that does include behavioral health treatment if needed. Prescription drugs are covered. One thing I'd note here is that you'll want to look at the formulary, which is the list of covered drugs for a plan, because they can vary from plan to plan. So if you're looking at plans in the marketplace and you identify a couple of plans you're interested in, just take a look at their list of covered drugs and make sure that the drugs that you're taking are on the formulary for the particular plan that you're interested in. Rehabilitative and habilitative services and devices are also covered, and these are basically services and devices to help people with injuries or disabilities or chronic conditions gain or recover mental or physical skills and help them improve. There are also laboratory services that are covered if you need any tests done. Preventive and wellness services and chronic disease management services are covered as well. And then lastly, pediatric services for children. And for children, that does include oral and vision care to make sure that that's covered for them. Oral and vision care are not part of the standard set of benefits for adults, so they don't have to be covered by a plan, although some plans are choosing to offer them to you as optional benefits. All right, so even though all of these qualified health plans do have to cover that same basic set of benefits, they can still vary in certain ways that are important for you to look at and think about when you are considering your health insurance options and narrowing your choices down to enroll in a plan. So there are some plans that may cover additional benefits, like I just mentioned, with vision or dental. These aren't required benefits, for instance, but a plan can choose to offer them as an additional benefit. Plans also will have provider networks, so you'll have to see certain providers, certain doctors or specialists, or use certain hospitals depending on the plan. So that's something that you'll want to look at and make sure that you understand what the network of the plan is, and take a look and see if the doctors that you use most often or the specialists that you use most often are in the network of that plan to make sure that you'll get coverage for the services that you need. Each plan, of course, will have a monthly premium that you'll pay each month to belong to the plan. There may also be set co-payment amounts, which is like a set dollar amount that you would pay for a service, like, for instance, $25 when you go to the doctor. And also co-insurance amounts, which is a percentage of the cost of the service that you would be required to pay. Like perhaps if your co-insurance is 30% and you had a service that cost $100, you'd be responsible for $30, for instance, of that $100. But the premiums, the co-payments, and the co-insurance amounts, they can vary among plans, is the point. And so you'll want to make sure that you look at those amounts and understand how they vary in the plans that you're looking at. The quality of care can also vary among plans, and also the coverage level and the type of plans. And I'm going to skip over those now because we're going to get to those on the next couple of slides here. So for the plans in the marketplace, there are health plan categories. The plans are categorized into these different metal levels: bronze, silver, gold, and platinum. And this helps you to understand how much the plan will pay and how much you will be paying for your covered health care services. So if you look at the bronze plan there, the bronze plan would cover approximately 60% of the cost of covered services for you, and then you would be responsible for about 40% of the remaining cost of covered services. all the way up to the Platinum plan that would cover 90% of the cost of covered services for you, and you would be left to pay the remaining 10% of the cost. Generally speaking, the bronze plans, for instance, would have the lowest monthly premium, but would leave you paying more out of pocket when you actually needed to use services. And that would be compared to, for instance, the Platinum plan on the other end of the spectrum that might have the highest monthly premium up front, but would leave you paying less out of pocket when you actually use services. So this is just something to keep in mind when you're looking at plans, and it can help you compare plans to one another to understand how much they'll be covering. There's also something that's called a catastrophic plan in the marketplace, and this is a plan that has a very high deductible. So there's a high amount that you would have to pay up front for your medical costs, and it would have a lower monthly premium, so it would be cheaper per month, but you would have that high deductible you'd have to pay before all of your health care services would be covered by the plan. One important thing to note is that catastrophic plans do include coverage for up to 3 primary care visits per year and also preventive services at no cost even before you've met that deductible. So if you have one of these plans, you can use it for certain limited things before you meet the deductible, but for most things, you'll be paying upfront until you meet that deductible. These plans are only available to certain people in the marketplace. They're available to young adults under age 30 and also to people who get a hardship exemption or waiver from the marketplace. And we'll talk about that more later, but basically what a hardship exemption is it means that you have certain circumstances, certain financial or life circumstances that would make it a hardship for you to purchase insurance through the marketplace. And if you do have one of those exemptions from having to purchase coverage for a hardship exemption, that would make you eligible to purchase one of these cheaper catastrophic plans if you would like to do so. All right, as I mentioned, there's the Small Business Health Options Program, the SHOP marketplace for small businesses. It's a streamlined way for small businesses to offer health insurance. It's a new option for them. Again, they don't have to go through the SHOP marketplace, but they may wish to. There are additional benefits that this SHOP marketplace may have over what they're currently doing or using. The SHOP marketplace offers access to the same types of qualified health plans that we've just been talking about. They cover those same set of essential health benefits. It also offers tax credits to make it more affordable for small employers to offer insurance to their employees. The SHOP marketplace is open to employers who have 50 or fewer employees in 2015. And in a couple of years, that's going to open up even more broadly and will be available to employers who have 100 or fewer employees. There's a separate help desk for SHOP employers who may be interested in purchasing coverage, and that number is on the screen for you there. There is a more general health insurance marketplace call center that takes questions, and we'll have that contact information available as well at the end of the presentation. All right, so to be eligible to purchase coverage in the individual marketplace, we're switching gears back to that individual marketplace, you do have to live in the service area of a marketplace, which is generally a state. You have to be a U.S. citizen or national or a non-citizen who is here legally. You also cannot be incarcerated. So if you're in jail or in prison, unless you're pending still the disposition of your charges, you won't be eligible to purchase coverage through the marketplace. But if you do meet those requirements listed on the screen, you can purchase coverage. You can also apply for Medicaid or CHIP at any time. So we're going to talk about some enrollment periods during the presentation about when you can apply for coverage in the marketplace. but when we're doing that, just keep in mind that you can apply for Medicaid or the Children's Health Insurance Program at any time during the year if you think you might be eligible. I mentioned there's the tax credit, the way to lower your premium costs through the marketplace, and that is called the premium tax credit or the advanced premium tax credit. And basically this is a way to either give you help up front to pay the monthly premium or to give you a refund on your income taxes for all or some of the amount that you've paid for your health insurance premiums. The eligibility for this benefit is based on your household income and your family size at the end of the year. And it's available to people who have income between 100% and 400% of the federal poverty level. In order to be eligible, you do have to purchase a qualified health plan through the marketplace. And you also can't be eligible for certain other types of coverage, including government-sponsored coverage like Medicare or Medicaid or TRICARE, or affordable employer-sponsored insurance through your job or your spouse's job. There are a couple of ways you can choose to use the premium tax credit if you are eligible for it. You can go ahead and take some or all of the premium tax credit up front so that it immediately reduces the amount that you have to pay to your plan for your monthly premium. You can also choose to get it later. So you can choose not to take any of it now and just get the entire amount that you're eligible for back on your tax return the following year. That decision is up to you if you're eligible, but one important thing to keep in mind is that you should report changes to the marketplace if you have a change in your household size or in your income so that you can make sure that you're getting the right amount of premium tax credit that you're eligible for and make sure that there isn't anything that needs to be paid back later on your taxes. There's also something through the marketplace called a cost-sharing reduction, and this is an additional way to help you lower your costs. This is for folks who have income at or below 250% of the federal poverty level. So its eligibility is a little bit lower than for the premium tax credit. If someone did meet this level, though, of course, they would be receiving the tax credit in addition, and they would be required to enroll in a marketplace silver level plan in order to get this benefit. And what the cost-sharing reduction will do is basically reduce the deductible amount that someone is required to pay. It will reduce also the co-payment amounts and the co-insurance amounts that someone would be responsible for through their health plan. And so this is a really great benefit for people who are at or below 250% of the federal poverty level. There's also a special provision for members of federally recognized Indian tribes. They have no cost sharing if their income is less than 300% of the federal poverty level. As you may have heard, Medicaid has also changed a little bit this year in a few ways in some states. The first big change is that states do have the option now to go ahead and expand Medicaid eligibility to an additional group that has, for the most part, not been covered in the past. And this group includes adults ages 19 to 64 who have income up to 133% of the federal poverty level. There is a 5% disregard, so it actually works out to 138% of the federal poverty level. And states do have the option to cover this new group. About half the states are offering coverage to this group, and about half of the states are not at this time, but states do have the option to change their mind in the future and can always choose to expand their Medicaid program to include this additional group. The second change that happened this year was a change to ensure Medicaid coverage for all children in all states who have income up to 133% of the federal poverty level. And then the third change that happened this year was basically a change in the way that income was calculated. Previously, states They could have different ways of calculating what income was counted or not counted toward determining eligibility for the Medicaid program or the Children's Health Insurance Program, and those calculations have now been simplified and streamlined so that for certain groups of people, those calculations will be made the same across all states. So as you may have heard, beginning this year, everyone is required to either have health insurance coverage that meets minimum standards. They have to have a coverage exemption to be exempt from the requirement to have coverage, or they do have to pay a fee on their income taxes. And we're going to go through each one of these scenarios in the next slides. So about 85% of Americans already have what is considered to be minimum essential coverage. And this is health insurance coverage that already meets certain minimum standards. And it includes things like employer-sponsored coverage that someone may have through their job, also Medicare Part A, Medicaid, the Children's Health Insurance Program, any coverage that's purchased through the marketplace or individual insurance policies that are purchased outside of the marketplace, also TRICARE and certain types of VA coverage. Anyone who has this, any of these types of coverage are covered and won't have to do anything to meet the requirement to have health coverage because they're already all set. The next group of folks are folks who can get an exemption from the requirement that they have health coverage, and they won't have to pay a fee. So all of the groups listed on this slide fall into that category, that second category. For instance, people who are members of federally recognized Indian tribes, people who have very low income and don't meet the minimum income requirement to file taxes, people who have only a short break in their health insurance coverage during the year, and that's defined to be less than 3 months of a break in health insurance coverage, they're also exempt and won't have to pay that fee. People who suffered a financial hardship that impacted their ability to purchase health insurance, also people who were incarcerated during the year, or people who didn't have access to affordable coverage, they will all be exempt from the requirement to have health coverage, and they won't have to pay a fee. One thing to note, though, is that even if they get one of these coverage exemptions and they're not required to buy health coverage, they, of course, then would not have health insurance. If they did need to use any health services during the year, they would have to pay the full amount out of pocket. And then the last category is people who may have to pay a fee when they file their 2014 federal tax return in 2015 and also in subsequent years. Less than 2% of Americans are expected to fall into this last category, but these would be people who don't have minimum essential coverage through their employer or through a government-sponsored program, and they also don't qualify for one of those exemptions on the last slide. So these folks will be required to pay a fee, but again, even paying that fee, it doesn't provide health coverage, so if people need to use health services during the year, they would have to pay for those services out of pocket. This next slide shows you what the fee will look like in 2014 and beyond. You would pay the greater of either a flat dollar amount or a percentage of your income, whichever is greater. So for 2014, the flat dollar amount is $95 per adult, or 50% of that for children, or 1% of your household income, whichever is greater. And these amounts, they are capped at certain levels. So for instance, if you were required to pay that flat dollar amount for 2014, the cap for your family would be capped at $285. And if you were required to pay the 1% of your household income, the amount you'd have to pay would be capped at the national average price of a bronze plan, because of course, you know, you shouldn't be penalized anything greater than what you would have been paying if you purchased the cheapest health insurance plan through the marketplace. So as you see, the amounts go up in 2015, and then in 2016 and beyond, these are the amounts that you will see. As I mentioned, there are certain times that you can enroll in the marketplace. We're in the first enrollment period right now, which is the initial enrollment period. It started on October 1st of last year, and it will go through March 31st, the end of next month. Anytime during this period, you're able to go ahead and go to the marketplace in your state and compare your health insurance options and enroll in coverage. After March 31st, your next opportunity to enroll in coverage through the marketplace will be the annual enrollment period, which will start on November 15th of this year and run through January 15th of next year. And then there are also certain special enrollment periods. If you have certain events happen in your life that may give you an additional opportunity to enroll. So for instance, if you move to a new area and you have new plan options available to you, that would give you a special enrollment period. Or if you have certain life changes like marriage or birth or divorce, those could give you additional opportunities as well. So this screen gives you kind of an overview of how the marketplace works. This is referring to the health insurance marketplace website at healthcare.gov. You would start out by going to healthcare.gov. You could create an account about yourself. You'd enter some basic information like a username and a password and select a security question to secure your account. From there, you would go on to the next step of applying, where you would actually enter some really basic information about your family. So it would include you, other members of your household, information about your income if you're interested in getting help to lower your costs. And once you did that, the marketplace would come back and let you know what you were eligible for. So whether you're eligible for a qualified health plan or for help to lower your costs, or also for Medicaid or the Children's Health Insurance Program. Your eligibility determination that you would get then would show you all the details about what you're eligible for. From that point, you could take a look and compare plans and pick a plan that would best fit your situation. And then finally, the last step would be enrolling. Once you found the plan you were interested in, you could enroll online or through the phone as well. There are 4 ways you can get marketplace coverage or help with your marketplace questions also. So you can get help over the phone. You can call the marketplace call center. The number is listed there on the slide in the upper left-hand corner. There are customer services representatives available 24 hours a day, 7 days a week, with the exception of just a handful of holidays during the year. These customer service representatives can provide assistance to you in English and in Spanish, and there's also a language line to help out in 150 different languages. This is for the National Marketplace Call Center. If your state does have its own state-based marketplace, you should either contact the call center for your state, or if you do call this national marketplace number, they'll be able to give you the contact information and put you in touch with your state-based marketplace. There's also the option to compare plans and enroll online. As I mentioned on the earlier slide, you can go through the whole account creation and application and enrollment process there. There's also an option there now, though, to allow you to preview plans and prices in your area, and that would allow you to enter just a few items of information, such as the state that you live in and your county and your age and how many household members you're looking for coverage for, and it would give you a really quick and high-level overview of the plans that are available in your area, so you can decide if you'd like to go ahead and go on through the application process. There's also in-person help available. If you are living in a state that has a federally facilitated marketplace or a state partnership marketplace, you can go to localhelp.healthcare.gov, and you'll get a listing of all of the assisters that are available in your area to provide in-person or phone assistance with your questions or your application or your enrollment. If you are in a state-based marketplace, of course, you'd want to check with the state marketplace in your state. There's also a paper application available for people who either don't want to apply online or through the computer. They can fill out a paper application, and it is available for download at healthcare.gov. As I mentioned, there's the in-person assistance available. There are a few sources of help that may be available in your marketplace. The first one listed there is the Navigator program, and this is a grant-funded program that exists in every marketplace nationwide and has people who can help you apply and facilitate your enrollment in coverage. They also do outreach events, so you may see them in your community doing enrollment events or seminars about the marketplace. There's also non-navigator assistance personnel. You may have heard these folks called in-person assisters. They have pretty much the same role as navigators, but they exist more in state-based marketplaces and state partnership marketplaces. And then lastly, there are certified application counselors, or CACs, that you may have heard about. These are people who they're not funded through the marketplace. They're people who already work, generally speaking, at local organizations that you may come into contact with, and they have been trained and certified as well, just like the navigators and in-person assisters, to provide help with the marketplace questions and concerns from people that they come into contact with. And these certified application counselors exist in every marketplace, so you could encounter them in your state, or you could ask them for help also. There are also agents and brokers providing assistance in the marketplace. And agents and brokers, I mean, they can help with insurance through the marketplace, just like they do with individual or employer insurance policies now. They do have to be registered in the marketplace in their state and trained as well to provide assistance. So we often get questions about how the marketplace coverage works with other types of health insurance coverage. So we have just a couple slides at the end of the presentation here to address that topic. We get a lot of questions about the marketplace and how it works for people with Medicare. So we just want to make sure that you know that Medicare isn't part of the marketplace. If you do have Medicare, you don't have to do anything. You can just keep your same Medicare benefits that you have. Your benefits won't change. And it is against the law for someone who knows that you have Medicare to sell or to issue you a marketplace policy, even if you just have Medicare Part A or Part B. So just keep that in mind. If you don't have Medicare yet, but you become eligible for Medicare after you join a marketplace plan, you have a couple of options. You can either arrange to cancel your marketplace plan to coincide with when your Medicare coverage starts, or your second option is to keep your marketplace plan after your Medicare coverage starts. But one important thing to know is that once your Medicare Part A starts, you will lose any financial assistance you were receiving for your marketplace plan. So if you were previously getting tax credits or cost-sharing reductions to help you pay for your marketplace plan, those forms of financial assistance will stop once you get your Medicare Part A. There's also been questions about COBRA, and of course COBRA coverage is coverage that may be offered to you when you leave your job to allow you to extend your job-based coverage for a certain period of time. People with COBRA have a couple of options as well. They can drop their COBRA and enroll in a plan through the marketplace, which may work out to be cheaper for them in some cases if they're eligible for financial assistance to help them lower their costs, since COBRA premiums can be quite expensive in many cases. They can drop that COBRA and enroll in marketplace coverage either during the open enrollment period, which is happening right now, or they can go ahead and wait for their COBRA coverage to expire or end after the end of their eligibility, and then they can get marketplace coverage within 60 days of that COBRA expiring through a special enrollment period. There are also folks who have had coverage through the pre-existing condition insurance plan, or PSIP, and this is basically a plan, it was a transitional plan that a lot of folks were enrolled into before the marketplace was operational. And this plan was for folks who had trouble getting traditional insurance policies issued to them because they did have pre-existing health conditions that would either cause insurers to deny them coverage or charge them much more for their health conditions. So people who had enrolled in this transitional plan will need to transition to the marketplace. It's not an automatic transition, but these folks need to know that their PSIP coverage will be ending on March 31st. I apologize, it still says January on your slide, but there was an extension. So the PSIP program now ends March 31st of this year. And folks will need to apply for marketplace coverage by March 15th in order to avoid a break in their health insurance coverage. All right, so we have a few key points to remember just to wrap up. The marketplace, of course, is a new way to find and buy health insurance coverage. It's a new option that's available to you. You know, you don't have to buy through the marketplace. You can still you know, get coverage through your job or also through the individual insurance market if you would like to, but this is a new option for you. And it is the only place where you could get possibly lower costs on your health insurance coverage through the premium tax credits or the cost-sharing reductions. In both individuals and businesses, of course, have marketplaces to help them find insurance that fits their budget and their needs. States, as we talked about, have some flexibility to establish their own marketplace if they would like to do so, or to operate one jointly with the federal government. There's help for individuals and also small businesses to help lower their costs. And there's also assistance, in-person assistance, phone assistance, and online assistance to help you with your questions and to help you get the best coverage for your needs and your budget. We have a website that we'd like you to know about where you can go to get the latest resources on the marketplace. That website is marketplace.cms.gov. And if you go there, you will find just a ton of resources. We have videos, for instance, that show you what the application process looks like, the enrollment process. We also have fact sheets and publications. We have PowerPoint presentations as well, such as the one that we're going through today, and also presentations on different topics and more in-depth too. So if you're looking for more information, we really encourage you to check out this website and see what's available. The other website, of course, as I've been mentioning, is healthcare.gov. And that is a great place to go also to get answers for your questions or to take a look at the plans that are available in your area. So if you want more information about the marketplace, we also encourage you to check out these resources. You can subscribe to get email alerts and also text alerts from healthcare.gov to get updated as things change. You can also sign up to get updates at marketplace.cms.gov. And if you follow social media sites, we're also on Twitter and on Facebook as well. And that wraps up the presentation.
Great. Thank you so much, Stacey. That helped me, and I want full disclosure here to tell you that I went on our local. We're in Maryland. I went on the Maryland healthcare site a couple weeks ago. I found it easy to navigate. I had no problem. I am thrilled with my new healthcare coverage, which will be starting March 1st, and it was an altogether wonderful experience. I really got to look around, and I hope everyone will have as easy an experience as I did. But in the meantime, and I apologize, they just started removing snow outside my window, and I hope everyone can still hear me. We did get a couple questions in, and Stacey, I want you to cover these if you don't mind. I think there was a little confusion about once you sign up, when are you allowed again to change your plan? Maybe you need to talk about open enrollment again.
Sure. So once you sign up, you still have the opportunity now to sign up during the open enrollment period through March 31st. But once that time period has passed, once we're past March 31st, your next opportunity to enroll will be November 15th through January 15th. So for most people, that will be their next opportunity to enroll, November 15th through January 15th. And you could either enroll in new coverage at that time, sign up for the first time, or that could also be your opportunity to take a look at the plan that you had for 2014 and see if that plan is still going to work for you for the next year, or if it would be to your advantage to switch and sign up for a new plan.
That's great. Is there, if one signed up in open enrollment for the November 15th, when change plans, November 15th, when would that become effective?
Sure. So if someone changed on November 15th, that coverage would be effective on January 1st.
Okay. And what about if there is a change in status? Say you got married or you had a child, and you re-signed up for a new plan, endorsing your new circumstances November 30th, say, would that begin again January 1st?
So if you signed up for a new plan, through a special enrollment period, in many cases that would start on January 1st as well. Great.
There was another question about what happens. We'll go on. Someone has signed up. They're all set in their plan. They have a medical need outside of the state they're in. So that you signed up in Maryland, it's effective for Maryland, you go to Illinois and something happens, you need to go to the doctor. Does your health care plan cover this?
So there are a couple of factors there. It may be covered. It would depend. The first thing that you'd want to look at is whether or not it's an emergency situation, because if it is an emergency situation, the plan will be required to cover you even if you are out of your plan's network for emergency services. But if you are traveling out of state and it's not an emergency service per se, but you do still need to use a service, it will depend on the type of network that your plan has. So that's why it's really important to look at the plan's network and understand, will it just cover you in your county or in your state, or will it cover you out of state? There are some plans that are multi-state plans that will cover you in different areas, and there are some types of plans that are more restrictive and might only cover you in the few counties surrounding your home or in your home state. So that's definitely a factor that you'd want to look at and understand before you sign up for a plan.
I see. Now, the necessity for one getting a plan that covers more than one state, if I may give an example, a lot of people with NF find that an NF special, they may have only gotten something that covers them for their routine needs in California. I will just claim a state. However, there is a specialist in their kind of NF who's in Boston or in Baltimore. Does that qualify for as a catastrophic event where they can change their health plan in order to have it cover their out-of-state needs?
I think I missed just the end of your question. I'm sorry. Does it qualify as what type of an event?
Well, I was wondering if that was under the rubric of catastrophic needs, or is there or would it cover the ability to move to a specialist out of state, even though your particular coverage doesn't? I mean, would you be allowed to change coverage? Would that qualify as catastrophic?
Would you be allowed an opportunity to change plans? Is that what you mean?
Yes.
If you permanently moved, yes, you would have an opportunity for that. But otherwise, unless you had another life event that would give you a special enrollment opportunity, then no. So that's why it is important to check and make sure with the plan and see what type of coverage they may cover outside of their network.
That's very good advice, because we do have many people who live in a state where there is not a neurofibromatosis specialist, and in anticipation, it's one of those checklist things they need to consider. Does this cover other places? And if one doesn't just readily know that from looking at the website, is that where you could call in to a navigator to find out if the plan you're thinking about covers out of state?
Yeah, you could definitely get help from a navigator or from the call center as well with questions about plan networks and what would be covered. I'd also encourage you, if you're looking at a plan that you're interested in, to call the plan too and talk to them about the providers that are in the network, because they should be able to help with that as well.
That's very good advice. Thank you. Now, unfortunately, we need to wrap up, although we could talk to you again for an additional hour and still have a number of questions. Stacey, I want to thank you so much. Stacey Platte and the Centers for Medicare and Medicaid, we want to thank them for sponsoring this. We also want to thank all our listeners for joining us. Within the next couple of days, I will be posting this complete session to YouTube. Please revisit the program if you missed something. I know I will be. Or share the link with someone who may need it. You have a wonderful opportunity to get everyone covered without the burden of pre-existing conditions. We will try to check in with you via our website, www.nfmidatlantic.org, as well as email blasts if we have new resources or help on this topic. Those will be on our website as well. NF Mid-Atlantic also provides communication with patient support advocates and a caregiver support advocate. This is not, this is different than a healthcare advocate. These are people who share the diagnosis and are available to share feelings. They do not give medical advice. They do not give health insurance advice, but they serve as sympathetic ears if you feel that you need that. Please feel free to contact me about that service. Our next webinar, I think you'll all be interested, will be held April 1st, 2014 at 11 a.m. It is also a free public webinar sponsored by Friends of NF Mid-Atlantic, and it is called The Content of Character, Portraits of People with NF, presented by artist Rachel Mindra. This webinar will be especially interesting to this audience. Again, check our website for details and to register. I also want to note that all our webinars in the past year are available with the cost of a donation, other than the free ones. That includes our two-part grief series, our webinar on family stress, our primer for caregivers, and our examination of how it feels to look different. Thank you again to our audience for your participation, and to those of you who asked questions, of course, and a very heartfelt thank you to Stacey Platte, who put the impossible in understandable format. We look forward to hearing more, and we look forward to hearing great things about healthcare.gov. Thank you very much, Stacey.
Thank you.
Take care. So I am going to close out this webinar for everyone. Thank you all for attending.